show me right where your navel is, please. Very good. I'm gonna just set this right in here. And again, whichever side you want to use is fine. What is it? 5 to 15 millimeters, I think, is normal, considered an acceptable range, or 3 to up to 3/5 of an inch, I think.
Did you say apparent?
Apparent,
Okay.
yeah, but for either one of these leg lengths, okay? But the first one is apparent, and the way I remember, can you show me your belly button again? Thank you. Cool. The way I remember that is, this looks like an A, right?
Right.
So that's our apparent, right? Our true comes from where? And you can do it in millimeters, you can do, if you're doing it in millimeters, then you should have, 5 to 15 millimeters difference is considered an acceptable range. Yes. Okay, that's your true leg length, apparent and true leg length. The last thing we're gonna do is we're gonna do a deep tendon reflex of our hamstrings. You've heard about that. I don't know if you've ever done it. Just, way to do that is just to have the patient relax their leg against you here, just like this. Come up. It's for those of you in the cheap seats, if you wanna move your seats. I'm gonna grab onto the semimembranosus, semitendinosus tendon here, and I'm gonna look for any type of reflex that takes place within the thigh muscle.
She has it in the arm.
Okay, so everybody got that? So that's your full examination in the supine position. Okay, then we're gonna have our patient, would you lay prone for us, please?
You would do both sides, right?
Yes. I probably won't have you do both sides on the test. Probably will not have you do both sides on the test. In fact, like when we get down into the ankle and so on, sometimes, like when you're doing all the different ligaments and muscles and showing me the tendons and everything how they function, for time purposes, I usually just have you do one. Sometimes I'll have you do two, but of course, everything we're doing up here is, pretty much right there, so. In this prone, the first thing we're gonna do is make a touchdown, right? It's temperature and dermatome, right? And peripheral sensory nerves, so remember that. So our temperature, you're just gonna come down. And there's a bursa here, and that's your glute maximus bursa. That's right over the inferior lateral edge of our ischial tubes. Now, remember when we did the dermatomes coming down here, we came down 12, 1, and 2. Has everybody got that? Or so 12, 1, and 2. Basically what we're gonna do, we're gonna start up with 3 on this side. We'll just make it easier. I could have done it differently, but I was trying to just make it so you can remember. So 12, 1, and 2, then we're gonna do 3. Does this feel like this? And I've already informed her, so that's why I'm not doing it again. And she says, yes. And does this feel like this? Okay, and then 5 is gonna come down here. It all comes down a little lower, like a little rainbow. And then S1 comes down on the lateral side, as you guys know. And S2 is a little more medial. Does that feel like that? Okay. And the only peripheral sensory nerve we're gonna do here is does this feel like this? Is our posterior femoral cutaneous. Okay. After we've done our what's our next thing we want to do? Our bony palpation. Now, you know all these bones. You've been palpating them probably since quarter 1. Again, you're going to go to the iliac crest, but then you're going to come down. What are these? PSISs. You're going to get the what? Sacral tubercles. I'm going to touch the bones you sit on here and here. And I'm going to come out here again, get the greater trochanter, and I'm going to come down. So everybody got that? Okay, our soft tissue in this examination is we're going to be doing more just like ligamentous and muscular. So ligamentous, the chief ligaments here, what do we have? The sacroiliac ligament, the sacrospinous, sacrotuberous ligament, right? We want to make sure that we pick up our piriformis muscle that gets involved with a lot of people. And what was that?
Ischium. The ischium.
Ischium. Well, we've already palpated the ischium, but what was the other? I think there was another soft tissue. Oh, the hamstrings. Okay, you can just come down and get the hamstrings. Oh yes, and then they get glute mass bursa. Thank you very much. And then come out here and get the greater trochanteric bursa again as well, okay? If you've done the greater trochanteric bursa in your examination, you wouldn't have to do it again, but on the test, maybe we've only done the prone. So I want you to make sure that you pick that up. Thank you very much for reminding me, okay? All right?
So on the test, will we do prone or supine?
Well, you're gonna get 5 points off of here, and I think I already showed you guys the test. It's on there anyway, it shows you how each one is worth so many points, and I'm gonna pick 5 points. I might give you one thing supine, one thing prone, one thing visual, it'll work along that line, okay? So if I give you prone soft tissue, then pick up the bursa if you've not already done it supine, and you're not gonna get both, I guarantee, so. There's something else I wanted to say. Can't ignore this, it'll come to me eventually. Okay, next thing we wanna do is what? Active, passive, and resisted range of motion. The only motion we're really gonna do here is our hip extension, okay? Now, the problem with doing hip extension is we're looking for hip extension. We're not looking for SI extension, so keep that in mind. If you are interested in SI extension in your examination, I'm not sure what you're going to be looking for, then you might want to stabilize up here like you've done. But if we're looking strictly for the acetabulum, we have to stabilize on the ischium and hold it down. Has everybody got that? So again, I'm going to touch the bones you sit on. I'm going to come here and I'm going to hold this down. And I'm going to ask you, can you raise this leg off the table as high as you can?
Nope.
There you go. Good. Right? So now you can see we're getting strictly the motion there. Okay? So, again, try this one. Good. Very good. Then what I'm going to do is I'm going to do the what? Passive. And I'm going to say, okay, can you push up against me, please? Thank you very much. And again, thank you very much. Okay? Active, passive, resisted range of motion. All right, and I think that's all for the prone. And the next part of our exam is going to be orthopedic tests. So you could get any orthopedic test. This would be a good time to review some of the orthopedic tests. Anybody have any orthopedic tests they'd like to review for the hip?
Can you do the log roll?
Can you stay as that patient?
Yeah.
Well, I'm gonna have you lay supine. We'll do a bunch for hip lesion. One of them is the log roll test. And what the idea of the log roll test, you're gonna have a hand just proximal to the malleoli, just proximal to the knee, and you're just gonna roll this back and forth. And one of the reasons for this test is it helps to really isolate that hip joint.